By the time many teenagers sit down with Peg Raschenberger, they are already dealing with serious mental illnesses and need carefully targeted medication and therapy. But the registered nurse may be the first professional they've ever seen. Raschenberger works at Milwaukee County's Youth Detention Center, where young people wait in lockup to find out whether they'll be going to prison or back home, often with referrals for mental health services. It's almost like they have to get into some sort of trouble before they get into services, said Raschenberger, who also serves as interim dean of Alverno College's Joanne McGrath School of Nursing. They end up being incarcerated for really what is a health issue, and it shouldn't have gotten that far. The shortage of mental health professionals is a crisis, particularly for youth, and more particularly for low-income families who use public insurance. Demand for mental health services is up, as USA Today Network Wisconsin has explored in the Kids in Crisis series. Teachers report more kids struggling to cope with traumatic experiences while suicide rates rise. Families are becoming more comfortable seeking help. But seeking help and getting it are two different things. A Journal Sentinel analysis of 2016 workforce data found that Wisconsin is worse than most states in its per capita workforce of all types of mental health professionals, nurses, counselors, social workers, psychologists and psychiatrists. Data were compiled by researchers at County Health Rankings and Roadmaps based at UW-Madison. Our society is recognizing the value of mental health care, and yet we haven't really increased the supply, said John Lerman, a psychiatrist who chairs the Psychiatry and Behavioral Medicine Department at the Medical College of Wisconsin. Experts identify several financial and regulatory bottlenecks choking the supply. Some argue they are part of the legacy of treating mental health as a less important field of medicine. On the financial side, insurers reimburse behavioral health services at a lower rate than other medical specialties. Exacerbating the situation, many patients are covered by Medicaid, which generally pays even less. In Wisconsin, government funds reimburse mental health providers for about half their costs for seeing Medicaid patients, according to Linda Hall, Executive Director of the Wisconsin Association of Family and Children's Agencies. The result? Health systems have put fewer resources into expanding behavioral health services, particularly when compared with more lucrative specialties such as orthopedics, cardiology, and oncology. And some psychiatrists set a limit on how many Medicaid-enrolled patients they will accept, causing long wait lists or no list at all. Children's Hospital of Wisconsin is one of those systems taking a financial loss on its psychiatry services, according to Tracy Orter, Director of Mental Health Services for Children's. Most of the patients are on Medicaid. The wait list to see a child psychiatrist stretches for months, Orter said. Children's attempts to schedule a first appointment within 3 months of a family's call, but that doesn't always happen.